mentioned, this paper is an open-label, non-randomized observational study, duration for 12 weeks, including both type 1 or type 2 diabetic patients. Patients were divided into two arms, one arm receiving insulin detemir and the other arm receiving biphasic insulin aspart30. Included were patients poorly controlled on oral anti-diabetic agents or insulin naive, or patients who are already on human insulin shifted to analogs. A total of 3,131 patients were recruited, 37 of which were type 1 patients, and 3,093 were type 2 patients. A total of 1,432 were randomized to the insulin detemir arm. We had 68 withdrawals, so that only 1,364 patients completed the study. The baseline characteristics of the patients are shown as follows. Majority had age of 55.7. There were more females than males, and the mean BMI was 25, with a mean diabetes duration of 7 years. The average HbA1c at baseline was 9.5%, and the average fasting plasma glucose was 211. 81% of the patients were on oral anti-diabetic agents at baseline. 8% were on combination insulin plus oral agents, and only 5% were on insulin. The reasons, as stated by the physicians for starting on detemir were to improve fasting blood glucose, to comply with the latest algorithm to start insulin therapy earlier, to improve the HbA1c, and to improve postprandial blood glucose levels. There are already 359 patient years of treatment with detemir, and so far only a few adverse events were noted. One patient reported rashes, probably related to the study drug. No serious adverse drug reactions have been reported. Our study objective included noting for hypoglycemic episodes. And during the study duration, there were no major hypoglycemic episodes reported. However, there were minor hypoglycemic events, but it was lesser from the baseline. Baseline, there were 519 events, and at the end of the 12 weeks trial, only 207 events were reported. In terms of nocturnal hypoglycemic events, 65 were reported in 25 patients, giving a 1.7% incidence. And the change in HbA1c was notable at 2.4%. At the end of 12 weeks, the average HbA1c was only 7.2 compared to 9.5 at baseline. So that more patients were able to achieve an HbA1c of equal to or less than 6.5 at the end of the trial. The change in fasting blood glucose was also noted, and it was lower compared to the baseline. Another significant finding in this study is that there was no change in body weight. At the end of 12 weeks, the average body weight remained at 64.8 kilograms. Compared to the baseline, there was a slight increase in the dose of the detemir required to maintain adequate HbA1c control. So what we were able to show in this study is that with the use of detemir, there was a reduction in HbA1c of 2.4% from baseline. There is an increase in the percentage of patients getting to target, improvement in fasting plasma glucose. There was a reduction of 81 milligrams per deciliter. There were no major hypoglycemic events. There was a reduction in minor hypoglycemic events, and the patients did not gain weight after 12 weeks of detemir. In conclusion, in Filipino patients with type 2 diabetes, insulin detemir was well tolerated, it improved glycemic control, and it was associated with lower incidence of hypoglycemic episodes, and it was weight neutral. This study, this is our disclosure, and thank you for your attention.
Thank you, Anne. Questions on the floor, please? You did mention on your methodology is open randomized, isn't it? Open, not randomized.
It's not randomized.
Okay.
It's open.
Only one arm trial.
The other patients were put on Biphasic.
So
we will present that in another paper.
Do you have comparison with data between like direct determine and
there was no comparison. This is just an observation.
Any question? Do you have data on the dose of determine what is your average dose of determine your patient?
I'm sorry, it was not recorded.
And your population is mixed type 1 and type 2?
Yeah, there were only 37 type 1
also
patients.
included in the analysis?
Yes.
Okay. Question, please?
Twice a day? No,
yeah.
this is just
any patient on 2 injection?
All of the patients were given single dose of insulin per day.